My name is Michelle Capanta. The topic of the day is closed-loop insulin delivery for glycemic control in non-critical care. Definition: an automated system that delivers insulin in response to glucose levels can address this need. Closed-loop glucose control, also known as the artificial pancreas, consists of a continuous glucose monitor and an insulin pump, coupled with a control algorithm that directs insulin delivery on the basis of real-time sensor glucose measurements.
Number 1. Hybrid closed-loop insulin delivery system.
Nighttime brings about the most fear in parents of children with type 1 diabetes, relinquishing all monitoring control and relying on the unpredictable pancreas. Millions of type 1 diabetes sufferers rely on the use of an insulin pump, providing an alternative to multiple daily injections. However, that open-loop system requires the patient to determine how much insulin the pump injects using information from a continuous glucose monitoring device, or CGM. Now, there is a revolutionary breakthrough removing the patient from the equation. In 2016, the FDA approved the first hybrid closed-loop insulin delivery system. Being hailed as the world's first artificial pancreas, the new technology enables direct communication between the CGM device and the pump. Making type 1 diabetes management easier than ever, studies show it stabilizes blood glucose at an unprecedented level, dropping A1C levels 0.5%. Hybrid closed-loop technology is predicted to have a huge impact on the diabetes treatment market and is a big step towards developing a fully automated insulin delivery system.
Application in medicine. This device, called an artificial pancreas, is designed to adjust insulin levels with little or no intervention on the part of the user. That is, the system measures blood glucose every 5 minutes and administration is automatic if necessary. The system includes a sensor that attaches to the body to measure subcutaneous blood glucose, an insulin pump that is attached to the body, and an infuse patch that is connected to the pump with a catheter that supplies the insulin. Despite the fact that the device adjusts to automatic insulin levels, users must manually change insulin to counteract the intake of carbohydrates, clarifies the FDA.
I'm Natalia Hepworth in Idaho Falls at Rocky Mountain Diabetes Center, where volunteers with diabetes are going to be testing a new product that should make balancing their blood sugar a little less complicated. On Thursday, Rocky Mountain Diabetes Center trained 8 volunteers on the Medtronic MiniMed 670G, the first hybrid closed-loop insulin pump.
It's the first of its kind to actually interact with the blood sugar and do some of the automation.
In type 1 diabetes, the patient's pancreas produces little or no insulin, which means the patient has to regularly monitor sugar levels.
This technology is what we call a hybrid closed-loop insulin pump, and it's a pump combined with a sensor, and the sensor is inserted in the skin, and the sensor measures blood glucose every 5 minutes.
Compared to a standard insulin pump for type 1 diabetes, this new technology automatically tests a person's blood glucose level and helps regulate insulin more consistently.
The pump is designed to respond to the blood sugar. So as the blood sugar is going up, the pump can change the insulin delivery to match that, or if the sugar is going down, the pump can reduce or shut off the basal delivery.
With the regular insulin pump, patients would have to check their blood sugars more frequently and make adjustments. This new device eliminates most of the tedious steps. Patients still have to do their finger prick test, but less often.
This just takes some of the burden off. It's really intense to manage type 1 diabetes, where you have to worry about your exercise and what you're eating and what you're doing, and what you can do before exercise and after, and this just has been amazing.
Idaho Falls local Brian Wood received early access to the device. He says he's looking forward to the added independence his pump will bring.
I'm excited to not have to worry and focus so much on the diabetes part of my life and be able to focus on other aspects of my life.
Rocky Mountain Diabetes is one of the few sites in the country to offer this product. It received FDA approval last fall and will be available soon to most patients.
We're a trial site for children for this pump as well, and so we have some children that are on this, and I've been involved in that trial as well.
This product is approved for patients 14 and older. If patients want to know if they qualify for this product, the best thing to do would be to consult your physician. In Idaho Falls, I'm Natalia Hepworth, EastIdahoNews.com.
Pros. The basal rate can be programmed at different infusion rates throughout the day, thus allowing a better adjustment to insulin needs. The basal rate can be increased or decreased temporarily over a period of time. In increments can be very small, 0.0025 units per hour, which is very useful in infants and young children, using only quick response text links.
My name's Miriam Goldfield. I'm 18 years old. The closed loop, it's known as the artificial pancreas. And it's basically, you have two devices. One is the insulin pump, and the other is a continuous glucose monitor. And basically they talk to each other. And the continuous glucose monitor, that'll send information to the pump saying, I'm high, my blood sugar is high, and then the pump will give me insulin according to what data it gets from the glucose monitor. It helps create a more of like a normal life for me, at least, because I don't have to constantly worry about putting in carbohydrates into the pump, because the glucose monitor and the pump are doing that for me.
So in this particular study, we are testing what we call a closed loop artificial pancreas. Now, artificial pancreas is a term that gets thrown around a lot, but it's not actually a mechanical pancreas. What an artificial pancreas is an insulin pump, just like the kind that people with diabetes often wear. But instead of manually determining the insulin doses, in an artificial pancreas, the doses are calculated automatically in an ongoing fashion every minute based on the glucose or sugar levels that is being continuously read from a little sensor device that the person with diabetes wears. Right now, people with diabetes test their blood sugars 10 to 12 times a day. They're calculating how much insulin they need. They're making adjustments in case they're exercising or if they're sick. And it all
Pros. The basal rate
has to be done.
Cons. In case of suspension of the supply of insulin can increase quickly the glycemia and the risk of developing ketoacidosis. The pump is always connected to the body through a catheter and infusion system, which can be uncomfortable for some people. The pump or infusion set can be seen or noticed under clothing. It supposes a greater expense than in the therapy with multiple doses of insulin. Issues applied in Ecuador. To achieve this approval, the FDA evaluated the every closed-loop system information obtained through a clinical trial in which 123 people with type 1 diabetes participate. This has shown that the device can be used safely in people from 14 years of age with type 1 diabetes. There were no reported adverse events, diabetic ketoacidosis or severe hypokalemia, low glucose level during the study. However, According to the FDA, risks related to the use of the system may include hypokalemia and hypercalcemia, as well as skin irritation or redness around the infusion patch of the device. This version of the device is not safe for use in children 6 years of age or younger or in patients who need less than 8 units of insulin per day.
Diabetes is not an easy disease, and it keeps you busy with blood sugar checks. You have to think about carbohydrate counting. You have to check your patterns, blood sugar patterns, and the whole idea about the system is we're trying to give people a break and let the system do some of the work so they don't have to think about diabetes as much, and they can enjoy their lives. So for people with diabetes, I think this is going to be an amazing opportunity to utilize technology to take away some of the burden of diabetes management. And another major advantage is while it's taking away some of the burden, it's also a safe system. And at night, the blood sugar control is outstanding, and none of the clinicians, I'm a clinician myself, we're not that good. We cannot adjust insulin dose every night for each patient and optimize it in a way that they will have perfect blood sugars throughout the night. And a lot of people worry about low blood sugars in the middle of the night, but if you have a system adjusting insulin and checking patterns, glucose patterns every 5 minutes, that's amazing. That's how you can achieve almost perfect control overnight, and you don't have to worry about it. You can sleep through the night. I'm a pediatric endocrinologist, so for my patient group, their parents can sleep at night. Our kiddos can go to sleepovers. They don't have to worry about, what's going to happen with blood sugars. Their parents can actually check the system, see what's going on. And on top of that, now they have a little bit of freedom to actually do whatever they want, because system will alert them if the blood sugar, the predicted blood sugar is kind of going to be low at a certain time point. So those are all benefits of it. For people with diabetes, as a clinician, 70 to 80% of our patients are not within target range. And despite everything we try, we cannot even reach a 50% or a 30% improvement. But with these systems, there's a great opportunity. And if you have 70, 80% of your patients in poor glycemic control, that translates into future complications. So while we're trying to discover the cure for diabetes, we can't afford to wait for a cure. In the meantime, we have to keep our patients happy, healthy, and from a clinician perspective, I think artificial pancreas hybrid closed-loop system can achieve better glycemic control and also reduce complications of future diabetes if we can keep improving blood sugar control, and our patients will be healthy until we discover the cure for diabetes. So we're hoping that those are going to be like some outcomes of hybrid closed-loop once it's implemented widely in the clinical field.
Conclusion. Among inpatients with type 2 diabetes receive non-critical care. The use of an automated closed-loop insulin delivery system results in significantly better glycemic control than controversial subcutaneous insulin therapy, without a higher risk of hypoglycemia.